Good morning. Good morning to you,
Yes,
Mr. Kinara.
we are happy to come and talk with you briefly so that you can highlight one or two things on the profession of the medical and also in relation with physiotherapy.
You are most welcome.
Thank you.
Yeah.
Now, kindly tell us more about yourself in a nutshell.
Neford Ongaro. I'm a doctor in training, senior lecturer at the Kisii University Medical School. I also do medical practice in the specialty of surgery, but particular focus on orthopedics. In orthopedic surgery, we deal with the joints and the back, trauma, and also other conditions that affect the system.
Yes. Thank you. How did you know about Kisii Physiotherapy Clinic and the staff?
Oh, for a long time, I have known the proprietor, Mr. Kinara, going to more than 15 years. We first met during a training workshop. And for the same time, I do consult within Kisii hospitals. I've always utilized his services and skills by referring people.
Yes.
But for the last 2 years, we have worked closer, especially from the premises of Kanyimba Hospital, where I practice from. Most of my patients, because I deal with joints and bones, they require rehabilitation after trauma or after surgery. So I work very closely with Kisii Physiotherapy services.
Oh, thank you. What was your experience like with the staff?
Oh, I've come to visit the place.
Yes.
Okay.
Yeah.
The Kisii Physiotherapy services.
Yes.
The setup is good. They are amiable. They are friendly. And I was happy to know what they give for patients. I looked at the equipment they have.
Yeah.
I was quite happy.
Oh,
Right.
fantastic. What most did you like about the clinic?
The setup.
What the setup?
It is provided for a waiting area, the good reception area.
Yeah.
They have a portfolio for both people who pay cash and people who are having insurances. But the actual service points, the equipment, the coach, the machines that are required, and the lighting.
Thank you.
And the ambience generally.
Thank you. Do you recommend the clinic for potential clients?
Definitely yes.
Okay.
Especially for the providers.
Yeah.
His leadership is Mr. Kinara, as I've said, of long-standing experience.
Yeah.
Personally, a number of patients I've referred, they give good feedback based on experience and outcome.
Thank you.
And actually, he's my preferred private physiotherapy provider.
Thank you.
Yes.
Now, Daktari, please highlight to us. We have patients who get operated on and then they are sent home. Sometimes it is not emphasized that they need physiotherapy. Is there a risk if they don't do physiotherapy, or they can just heal and be okay with operation? And two, within what period after operation does physiotherapy need to come in?
Yeah. Generally speaking, healthcare can be divided broadly into the traditional, the alternative, and then the convention.
Yes.
Convention is what you call the Western medicine, allopathic medicine. And in that branch of healthcare, the allopathic medicine, we first recognize the use of medicines, medical care, the use of surgery for the treatment of various conditions that require surgery, and there's a part of what you call the physical therapy. Now, physical therapy deals with what you call rehabilitation. Even people come down very serious, debilitating medical condition, they need to be recovered back to before the illness.
Yes.
So that journey, even after the maintenance work, requires rehabilitation process.
Yes.
And this is where the physical therapies come in now. For us specifically in the practice of surgery, when people undergo surgery, they calm down, they get bedridden, they are indisposed. Just by mere fact that they need to get out of bed, to chair, to walk around, that's a role of physiotherapy.
Yes.
But specifically for limbs, the lower limbs, i.e. the legs, the upper limbs, i.e. the hand, particularly the legs because they make us move around.
Yes.
Anytime you have an injury or surgery of the leg from the foot to the knee,
Hips.
to the hips, you need to move.
Yes.
So that movement, painful as it may be, or sometimes we overload. That's where the role of physiotherapy comes in. But most importantly, to prevent stiffness.
Stiffness.
And then even if someone has a good range of motion or stiffness, they need energy and power.
Yes.
So the physiotherapy also helps them to build the muscle,
Yes.
to build the strength. Those of who are in sports or occupation that requires a lot of movement, and they can also be retrained to go back to performance.
Okay.
So the role of physiotherapy in rehabilitation is very essential.
Yes.
Yes. In fact, you can have surgery for 2 hours, you stay in hospital for 2 days, you're going to recover for 6 months.
Yes.
So physiotherapy plays a big role in the journey between 2 days and 6 months.
Yes.
It's very important, especially our people need to appreciate
Yes.
that physiotherapy is important.
Thank
And
you.
it needs to be, people need to be made aware.
Yeah. Thank you, sir. Perhaps we need to have a small emphasis on the time of intervention between surgery and physiotherapy.
Oh yeah, timing.
Yes.
For
When to
personally,
start.
personally I recommend this.
Yeah.
Before surgery, the physiotherapist reviews the patient,
Yes.
informs the patient the necessity, and they undergo what you call psychological preparation.
Yeah.
Now, there are forms of physio that are actually required even when the patient is undergoing surgery,
Yes.
or soon after recovery,
Yeah.
positioning, sprinting.
Yeah.
The day after,
Yeah.
it shouldn't be any longer than the day after.
The day after.
Even if someone is in bed, we need physiotherapy to the body, to the lungs, to the heart, the muscles, to the
Yes.
abdominal. This improves movement in bed, improves digestion, improves breathing, because you need to breathe well to heal, you need to eat good food to heal all these systems. This
Okay.
physiotherapy. Then from there now we go to the actual movement therapy.
Yes.
So it's from day one,
Okay.
from the onset.
Sure.
The idea that go home, recover, and then come for physiotherapy, I think it should not be encouraged.
Okay.
And then physiotherapy should not be like before the normal people.
Yes.
Even those people who have hypertension or having high sugars,
Yes.
they need physiotherapy.
Okay.
Yes, even as you control the sugar and the blood pressure, we still need to move
The
parts of your body. Yes.
Oh, thank you so much. And we hear there is a word called sarcopenia, and that it implies loss of muscle power as people age. Perhaps about 55, 60 onwards, there's a gradual decline, and unless maintenance of the various limbs and even the spine is put through. There are various ranges of motion and the degree of strengthening is done. It can be, we hear there are some clients who start losing balance because some muscles have gone thin, especially the major muscles of the legs, the bigger muscles, the buttocks and so on. So what measure can physiotherapy play? Because we hear that thing comes, gradually without awareness. The muscles start thinning off slowly if it's not well activated.
Thank you very much. Very important question. This question can be looked into this from this perspective.
Yes.
Maybe what we have so far talked about are the people who are sick.
Yeah.
Now let's focus about the people who are not sick.
Yes.
With the age,
Yeah.
they lose strength.
Yes.
They lose muscle bulk.
Yeah.
Yeah. What you don't use, you lose.
Yes.
And this is really very true with muscles.
Yes.
You don't use muscles,
Yeah.
you lose them, both in bulk
Yeah.
and both in strength.
Yeah.
Yeah, that means power.
Yeah.
So it's important that a walking exercise, just a deliberate walking exercise, especially for people who are offices, people sit in office,
Yeah.
people are not doing our manual work,
Yes.
whose work is sedentary. It's important that they encourage walking.
Yes.
Walking is the easiest, cheapest, the most available.
Yes.
But you can also talk about preventive physiotherapy,
Yes.
whereby anybody above the age of 50, they need just to go to the physiotherapist,
Yes.
get an evaluation,
Yes.
get advice what you need to know about your muscles.
Sure.
In fact, if you're not physically, the body is not physically very active, then the mind deteriorates.
Yes.
So this is a normal age-related
Process.
we call it wear and tear,
Yes.
okay, or what you call degeneration.
Yeah.
You know, we degenerate, we grow, we reach the point where we no longer grow,
Yes.
we start degenerating.
Degenerating.
So besides that, eyesight, teeth, skin,
Yeah.
brain,
Yes.
organs can degenerate, muscles they do, and joints.
Yes.
Now, another aspect of that point, that question is loss of memory and mental function.
Yes.
This happens,
Yes.
especially after 70 years.
Yes.
Again, physical exercise improves, but that one, if someone does that because dementia, we will need a medical evaluation before
Yes.
we talk about very specifically. Yes, even those one physiotherapy is also indicated.
Okay.
And physiotherapy is not for muscles and joints.
Yeah.
All organs, including the special.
Okay.
Physiotherapy exercises for the mind.
Yes.
Yes.
Oh. That is pretty informative, Daktari.
Yeah.
We are grateful you have summarized it to the
Most
point,
welcome.
and we are grateful that you are doing a wonderful job.
Yes.
And you visit most of these hospitals in Kisii.
Yes, I do consult for most hospitals in Kisii. Generally, if they will happen to watch this short clip, we
Yes.
strongly encourage the build physio department. Physio is one of the most neglected.
Sure.
They should have a full department, not just staff on call. Full
Yeah.
department with protocols.
Yeah.
We need to recognize physiotherapy. Even the larger county government
Yes.
should provide for not just physiotherapists in hospitals,
Sure.
but actually physiotherapy and rehabilitation areas in the villages, in the communities, where people can walk, can run, can jog,
Yeah.
even have community exercises.
Yeah.
Yes.
So this is wonderful, and we thank God for such information, which is going to assist several people who will read it in the, educational programs in our website. So once more, we are very thankful, sir.
Karibu sana.
God bless you
Okay.
in a big way. Asante sana.
You too.